My name is Robin Asprey, my first ever digital glaucoma support group. I may well be a new face to most of you. I am the new development manager for Southern England at Glaucoma UK. I would like to take a moment to introduce our speakers this afternoon. We've got two speakers with us today from the ophthalmic pharmacy team at Moorfields Eye Hospital in London. We have Sarah Thomas, who is an advanced specialist pharmacist for medicines optimization. She helps people to get the most out of their medication. And we have Kathy Kitney, who is the senior pharmacy technician for education and training. Today, they're going to talk to you about how the staff in pharmacies can help you with your eye drops. I'm so glad so many of you have chosen to spend your afternoon with us, and I'm going to spend a few minutes talking about the format of today's talk, the technical side of Zoom, and who Glaucoma UK are. So just to go through a couple of the technicalities of this Zoom group, just bear with me a second. I'm just going to share my screen. There we are. Hopefully you can see that now. Oh, there we are. There we are. Some of the technicalities of this Zoom group. We cannot hear or see audience members, but you should be able to see and hear me, Kathy, and Sarah. We're also being streamed live on Facebook, and if you're watching there, you can ask questions by commenting on the feed. There will be 2 short polls launched during the webinar as well. These are here to help us see the difference that these sessions are having, and if you feel you are learning things. I'm going to launch the first one now, and this one will stay open for just a couple of moments. If you're having any technical difficulties, try turning off other devices which are connected to the Wi-Fi, or try leaving the session and rejoining using the same link. Okay, I'm just going to leave that up for one more moment. If you could just, there we are. Sorry, I hadn't clicked the launch. My apologies. If you could just click those buttons. Wonderful, I can see those all coming in. Fantastic. If you would like to ask a question at any point, please do wiggle your mouse or touch your screen and you'll see a question and answer Q&A option at the bottom of your screen. If you have any questions for me, Sarah, or Kathy, you can type them there. Couple more seconds and then I'm going to just end this poll. Fantastic. Brilliant. Right. Oh, apologies. So there's the little Q&A icon down at the bottom there. You can ask questions whenever you think of them, and we can see these throughout the session. Even if you don't have any questions, please keep an eye on the Q&A panel. If you're interested in the answer to a particular question, you can click like. This means that the most popular questions will come to the top of the list and we'll try to answer them first. The chat button can be used if you're having any technical issues, but please keep your questions to our panelists in the Q&A section. It makes it easier for us to keep all of the bits that we need to be answering in one place. We really want this session to be interactive and cover the topics that you're most interested in. So please do ask questions. The only silly question is a question you wanted to ask, but didn't. We will activate closed captioning during this talk. If you want to switch them on, click on the button marked CC, live transcript. The closed captioning is like subtitles, they're automatic subtitles, and they can find medical vocabulary quite hard. We've seen trabeculectomy turn to Rebecca said to me, and even had trab turned to Trump, which isn't ideal. Glaucoma is the UK's only charity exclusively for people with glaucoma. Oh, We work in three main areas to prevent glaucoma sight loss. Firstly, we campaign to raise awareness of the disease. We want people to know what glaucoma is and about the importance of getting your eyes tested. The earlier glaucoma is diagnosed, the less likely people are to experience sight loss. Secondly, we provide support and advice to people with glaucoma and those who care for them. We have information leaflets, a helpline, a buddy service, and a patient forum, and we provide training and advice to professionals looking after people with glaucoma. All of our services are free. Finally, we fund research into the diagnosis, treatment, care, and prevention of glaucoma and those who care for them. We have apology. Oh, no, sorry. I've got all muddled and lost in where I am. Finally, we fund research into the diagnosis, care, treatment, and prevention of glaucoma. It's not a huge amount of money, but we do often provide initial funding for seed research that gets early stage research going. I'm going to hand over now to our speakers, Sarah and Kathy. Give me just a moment while I change my slides over for theirs.
I've lost Robin's. Robin, we've lost your audio.
Yeah.
Can you hear me now?
Yes.
Apologies. How much of me did you miss?
Just when you were going to introduce us.
Oh no, sorry. Right, so we've got Sarah and Kathy here from Moorfields. These are their slides. If you're able just to let me know when you want me to move on. I'm handing straight over to you.
Robin, our slides aren't up. I can't see our shared slides at the moment.
You can't see them. Okay, I'm just going to...
Oh, Robin, are we going with the recorded ones? I'm slightly nervous with my sound system here.
I've got the unrecorded ones.
We can hear you, Sarah.
Yeah, we can hear you.
Yeah.
How's that? Can you see them now?
No, I think, Robin, you'll have to unshare and then reshare.
Yeah.
Oh, there we go. No, they've come now.
There we are.
Are they there? Wonderful. Okay, over to Kathy and Sarah.
Hello, everybody. It's really nice to join you all this afternoon. So, as Robin said to you, we're from Moorfields Eye Hospital Pharmacy. We're part of a specialist team called the Know Your Drops team, and we aim to help patients with their eye drops and how to use them. And this presentation that we're going to give you this afternoon is just to give you an idea of how pharmacy can help you if you're not already aware that how pharmacy can do that. So if you move the slide, please, Robin. Sorry, it's not moved. Oh, there you go. Okay, so the first thing we want to talk to you about, we just want to really sort of run by the different members of people in the pharmacies that you attend. Some of you will have gone to outside chemists, some of you go to your hospital pharmacy, but there's a whole range of people that work in the pharmacy that you may not be aware of and what they can do. So this slide that we're showing you now shows you that we've got anything from apprentices to specialised pharmacists, technicians, and they all have a different role to play. So next slide, please, Robin. Okay, so what do they do? What do we do? So the first thing we do is medicines review. So we'll advise you on the medications that you're taking. We look at their safety, their side effects, and we also look for any interactions there might be. We also look at your prescribing. You may have been on medications, especially with your eye drops, for quite a long time with no review on them as to why you're still taking them, or maybe there's a better option for you out there. And our whole aim is to prevent disease and help everybody live healthier lifestyles. We also procure all of your drugs into our different places. So you will have come to your pharmacy and they would have said, we're going to have to order this in because we haven't got it on the shelf. So normally that only takes a maximum of 1 day, but you may have to wait a little bit longer. So you need to be aware of putting in your repeat prescriptions and things like that. Next slide, please, Robin. Okay, so pharmacy's there to help you achieve the best outcomes for your condition. So we're going to concentrate today on glaucoma because this is the condition that you are particularly interested in. We're going to go through the different types of eye drops. We're going to go through the ways that we can help you with that as well. And it's just to sort of reiterate that we're there as a team working with you and to give you the best options possible. Next slide, please, Robin.
Thanks, Kathy. I can take it from.
Perfect.
So, as Kathy said, pharmacy, we don't just stick labels on. There's a whole team who really do play very integral roles into making sure the medicines are safe and appropriate for you to use. And as Kathy said, this presentation isn't necessarily reflective of Moorfields practice. We've tried to make sure that this is national for all types of pharmacies that you might go to, and how those teams might be able to help you specifically with your glaucoma medicines. And as Kathy said, one of the things the pharmacist or the pharmacy technician might identify are certain issues with the prescription for your medicines that need to be sorted out before you then receive them. So in terms of an intervention, we might call it, it might be an interaction. It might be a glaucoma medicine, and it may be that you've got asthma and you're on some inhalers. And sometimes that can and be a problem. And it would mean that your asthma or the medicine might not work properly. So we're there to flag up any interactions and make sure those are prevented. And we also look at the evidence. How appropriate is this medicine for you in terms of your IOP, perhaps your intraocular pressure, for those who aren't aware. It's a marker of the glaucoma, and making sure that it's the right medicine in terms of all the evidence of how good it's going to be and all the national guidance. So we'll be checking that. We might also try and prevent any allergies. So perhaps you might be allergic to preservatives. So we would make sure that we're looking at the different bottles of eye drops that you have and to avoid that, and then making appropriate changes and suggestions for the prescriber. We might also look at the dosing times of what's being prescribed. Is that drop meant to be once a day? Is it prescribed once a day? Should it be really twice a day and it hasn't? Or has it been done more times a day? Is that safe? Is that appropriate? Do we need to make a change and suggest accordingly for that? Some drops work at specific times of the day a lot better than others, and we would look into that as well. So we are not just, as we said, sticking on labels that sometimes we can be looked at before in a pharmacy, and we really are there to make sure it's the right medicine for you and being taken at the right time. And sometimes that can take a little long time, but we try and do it as smoothly as we can without much delay. If you go to the next slide, please, Robin. Thank you. So really for this, we're really going to focus on how we can support you with your glaucoma management. And some of you might be using drops already. Some of you who are listening to this talk might have a friend or a family member you might be caring for who uses drops. Or some of you might not yet be on drops and might be interested in them. But the mainstay of glaucoma would be certain eye drops. If you go on to the next slide, please, Robin. And these eye drops come in all different shapes and sizes. There's so many different types, and they're classified into classes because of the way they work. So as I touched on earlier, and Glaucoma UK has several leaflets explaining what is glaucoma, and that it's really helpful to read if you're not familiar with this. But when you read those, or you may already know, there's pressure inside the eye with an intraocular fluid. And we want to make sure that pressure isn't rising and isn't too high, because that can affect the optic nerve. And some of these drops might work by reducing the amount of fluid that's produced, so that would reduce the pressure. And some of the other drops might increase the rate of filtration back into the body. So again, that would reduce the pressure. So they work in lots of different ways to try and manage this pressure. Usually, you'd be started on one drop. And I say usually, everything is very much tailored to the patient. And also, the doctor, prescriber, nurse, pharmacist can prescribe as well. So it could be any of your healthcare professionals who are managing this condition for you. But they might add in another drop. They might give you a double drop that's got two different types of drop in the one drop. And they might also change them completely. And that will really depend on how it's been managing your pressures and any side effects that you have been experiencing. They also come as either a preservative-free, they might be branded, or it might be what they call non-branded. So it could be a whole variety of things. But the main thing really to take away is that these drops do tend to be a long-term treatment. It's not something you might have for a rash. You see the rash and then you use the cream and it disappears after a week, or an antibiotic for an infection, and then that's the end of it. Once you've had the one bottle, it is something that needs to be repeated in your local setting, if it was from a hospital, and using every day. So say if you have a cream, you do tend to use it because you can see the benefits. Your red rash perhaps is going away and you'll make sure you use it. With drops for glaucoma, quite often you're not aware of how good it's doing with these pressures in the eye. But it is important to continue using them every day at the time that you have been, because then when you do come back for your tests, they will be able to tell whether these drops have been helping managing your pressure. So do use them each day, unless you've got some side effects or concerns, which of course you can speak to your pharmacy team about. The main thing on this slide is to remember that everyone is unique and your drops might differ from somebody else. You might have a next door neighbour or a friend who have been started on something different, but that might be because their target pressure for the eye is different. So please don't panic and don't worry if your drops are different to somebody else or they change. You can always ask, and there's definitely that shared decision making when you have your conversations with your prescriber. And if you're at all unsure, always ask the pharmacy team, your nurse, Glaucoma UK, or somebody for advice, and then they can signpost you if it's a bit more specific to be tailored to you. Thank you, Robin. Next slide. So as I said, there's all different shapes and sizes. And on this slide, we've tried to amalgamate as many as we could without being too small so you could see them. As I said, some are preservative, which come in little strips that you need to tear apart, or you might, ones that are in a bottle, these new wave with a blue tip that are preservative free in a bottle. There might be some easy squeezers, 10ml, 5ml, 2.5, whole variety. There's some like the Duotrav, Travatan that come in a sachet. And so there's lots of different ones out there. And you might be on a lubricant as well, and that might need to be pushed rather than squeezed. So your pharmacy team really there as well, they're there to help you use these drops and understand how best to use them. And I think Kathy's going to talk about physically using the drops on the next few slides. If you go on to the next one, please, Robin.
So we've just discussed that medicines aren't easy to use. I'm pretty sure that everyone's gone into their pharmacy and been given their eye drops, and it doesn't matter whether it's a hospital pharmacy or an outside pharmacy, and they will have handed over your little package with your prescription in, and you've been told one drop however many times a day. Now, I can't see any of you, but I'm pretty sure I've got some nods going on here that not one or not many of you will have been asked, do you know how to use your eye drops? So the next slide that we're going to come up with is just going to give you some idea of how difficult patients do find it. And this is what we found from talking to patients. So next slide, please, Robin. Okay, so why is it not easy to put in eye drops? This is what our patients are telling us. Click the button, please, Robin. Bitter taste in the mouth. This is an interesting one. Not everybody gets this. and I'm not sure how many of you would have been told about this. There is a little duct that goes from the corner of your eye down to the back of your throat. After putting your eye drops in, if you just press into that corner bit, just in the corner of your eye there for about 30 to 60 seconds, after putting that drop in, it allows the eye drop to stay where it's supposed to stay and not go down that little tube into the back of your throat. So if any of you are experiencing that, that could be an answer to that problem. A lot of you don't want to waste doctor or nurse's time. I know what it's like in our hospital. It's really busy. They appear really busy. You don't really want to bother them. And sometimes you're just having so many things thrown at you, you don't think to ask. Some patients find it takes them too long to put in. That's normally because they've not been shown how to put them in. So next button, please, Robin. So a few more. They run down my face and make me late for work. If it's running down your face, it's probably down to not being shown how to put the eye drops in properly. You do only need one drop. A lot of patients think, especially with the single doses, that they have to put the whole tube in. It still is only one drop, even in the little single dose tubes. You can't get the cap off the bottle. Well, we're going to talk about some aids to help with those sort of things. A lot of patients, I'll keep them in the kitchen, go to bed early and don't want to go downstairs. Well, if it's not a fridge item, keep them by your bedside cabinet. It's absolutely fine. You don't have to keep them in the kitchen. A lot of patients just think it's normal to struggle. And no, it's not normal to struggle. It's just that you've not been given the right advice, and that's what we're here to do. Next button, please, Robin. Some patients live alone and there's no one to help them. That's, again, if you are in that position, that's where we can help you. We can give you options. We can signpost you to different things. Sometimes it's just embarrassment, you know, like you don't want to admit that you're not putting them in. Sometimes you forget the times of the day. Well, we can give you pointers for that as well. Maybe set an alarm, or with a television program that you like watching every day, the television program goes on and you put your eye drops in. That's really good. Oh, we've had one patient we spoke to that her husband always put her eye drops in, and he goes away on Mondays and she couldn't put them in herself. So we spoke to them and we found a way that she could actually put them in herself, even though she still liked her husband to do it on the days that he was around, because it was a comfort thing for her, which is absolutely fine as well. You might work shifts and you're told to take them at bedtime. Bedtime can be any time, so we can work around that. Whatever shifts you're doing, we can advise you the best time to take it. There may be a language barrier. Again, we can provide leaflets in different languages to help you with that. And also in our hospital, we've got interpreters as well that we can help with that. So another button press, please, Robin. Okay, so we've got a few others that are a little bit repetitive, that they thought it was normal. The language, sometimes with the best one in the world, your actual medical practitioners will use language that you don't necessarily understand. I recently had a patient that, well, it wasn't a patient, it was actually a friend that sent me a letter they got from the hospital and said, if you can understand what they're talking about, you're a better person than I, because the letter actually came up with all of the medical terms that they had and didn't make any sense to them whatsoever. There was nothing in there that they could make any sense of. So don't be afraid to either talk to someone that you know in pharmacy or go to your local pharmacist. They can try and interpret what the doctor's saying. We can't always get it right, but we do try and interpret as well. So, okay, and you know, some people didn't know that they had to use them every day. So just reiterating what Sarah said, if you are on glaucoma drops, it is normally a lifelong condition, which a lot of people don't understand, and you will need to be using your eye drops to keep that pressure under control ad infinitum. So next slide, please, Robin. Okay, so we're just going to talk to you. This is a technique that we've learned over the years, myself and Sarah, talking to patients about how you put your eye drops in. Now, everyone has got their own way of doing it. And there is no right or wrong way. We don't want to tell anyone you've got to put it in a certain way. But one way that we have learned that does work for a lot of patients in their situation is called the wrist and knuckle technique. So next slide, please. Okay, you can see my colleagues there, one of them is Sarah. So it's wonderful. And we've got a leaflet. So when you go to the Moorfields website, all of these things are accessible on our Moorfields website. But it's called the knuckle wrist technique. Are we able to pop that video in here, Robin?
Let's see if the link will work. I might need to reshare my screen, but let's see. Fingers crossed.
And if it doesn't, it's fine. I'll go through it on the screen anyway. But the video's a bit more informative.
Can you see this?
Can
you see video?
I can.
Yep.
But it's not playing currently. Oh, it's
No,
playing now.
There we are.
Oh.
Hi, my name is Fiona Chiu. I'm one of the pharmacists who run the Know Your Drops campaign. I'm here today to advise you the best technique to put in drops into your eye. It is important to position your eye drop bottle accurately over your eye for the correct angle and safe distance. This helps to ensure that you don't damage your eye surface or contamination because of the nozzle of the drop touching the eye or the skin. To help you to put the drops into your eye correctly, we recommend the wrist and knuckle technique. And this is as follows. After washing your hands, twist off the cap of the bottle. Hold the bottle pointing downwards. Sit down or lie down comfortably. Tilt your head back. Pull down the lower eyelid with the fist to create a pocket. Rest the wrist on the knuckle of the fist. When you're ready, look up and squeeze the drop into your eye. By doing the wrist and knuckle technique, that will ensure that the drop will drop right into the center of the eye surface. Unless your clinician has advised otherwise, always close your eyes and hold the inner corner of the eye with your finger for 30 seconds. If there's any excess liquid, carefully blot it away with a tissue paper. When finished, replace the cap of the eye drop bottle and keep it away from the reach of children.
Yeah, so hopefully you found that useful. There's several reasons why we actually advise using that technique. Some of you may suffer from other conditions that are where you might have a slight tremor in your hand, or you might have pain in your hand. So by using that technique, what you're doing is you're steadying your hand like that on your eyes, and it helps to reduce that tremor. It doesn't work for everybody, but it's always worth trying that if you are having difficulty putting the eye drops in. And we would recommend that you do try and practice that as well, because it takes a little bit of practice to get the right angle of the eye drop in. So next slide then, please. Okay, I think it's over to you, Sarah.
Yes, thanks, Kathy. So just say with the technique, everyone's got their own way of doing it. If your drops go in, as Kathy said, if they go in fine at the moment, you don't feel like you need to change your technique, but this is, well, you are struggling with them, as Kathy said, drops running down your face. And also Glaucoma UK has it on there as well, but do visit Moorfields if you'd like some more information. And you may have these new style bottles, so they've been out for a while, they've been out for quite some time, but they might be relatively new to you. They're these blue tipped bottles. Sometimes they're referred to as Novelia, sometimes they're Numera, but it will just be whatever brand you've got. You might have seen these, and these are slightly different to the more traditional style bottles that you might be more used to. They're slightly softer squeeze, but that doesn't not necessarily mean that they are easier to squeeze. A lot of people find them easier to squeeze, but some people say they need a little bit more of a squeeze. They come in, I think 5 ml, 10 ml, there might also be a 15. Some people find the smaller bottles slightly difficult to squeeze, but they are relatively softer fat. So some people do find them easier. And the key things with these to remember is that you need to give them a break at the end of using them. So what we would recommend is, if you haven't used them before, just over the sink or over some tissue away from your eye, basically, just squeeze it and see how much dexterity you need to squeeze one drop out. We've had patients who will just squeeze it like they would normally do a normal bottle, a traditional bottle, and loads gush out. So they need to be a bit gentler with it. And if you just squeeze it and gauge how much pressure to apply for one drop, practice that a few times. When you then do it over your eye, you can be more reassured that you'll just get one drop out rather than huge amount. There's some air pressure in the bottles, and if you do find you're squeezing it too much and it's just coming out too much, and you just squeeze, too much air will come out, and then you might even find that the bottle won't squeeze any more out. So just be gentle with them. And when you have put your drop in, you do need to shake the bottle downwards to get rid of any residual liquid and prime it for the next dose. And all of that is in the patient information leaflet, and the pharmacy team may not have spent time with you because they may have perhaps assumed that you've had drops before, and perhaps you have assumed, oh, I've had drops before, this will be the same. It's not quite the same, but once you've got the technique, the patients that we've been helping seem all fine with it. You just need to know those couple of little bits and then perhaps practice. But it's all in the leaflet, and again, your pharmacy team should be able to help you with that if you're needing some extra advice. Next, Robin. Now, Kathy did mention earlier that there's all these different aids to help you, and these are called compliance aids, or just plastic gadgets. And again, they come in different shapes and sizes, and these help you position the drop over the eye and also help with squeezing them. And there's all different ones available, different colours as well, and your pharmacy team will be able to help advise you. Some of them are free on NHS prescriptions, other ones you might need to pay for. I think you can get all or most of them as well from Glaucoma UK, and there's more information on their website. There's a really good leaflet, booklet all about them. Equally, you can go to the Moorfields Know Your Drops, and there's pages of material as well to read. We often get asked, well, why just want the one that works the best? What's the one that everybody uses? Well, I'd love to answer that. I'm sure Kathy would also love to answer that, but there isn't a one size fits all. They might be able to fit different bottles, but all of us have different needs. And one of you might find squeezing difficult. One of you might have Parkinson's or a bit shaky, and you need a different one. One of you might be on round bottles. One of you might be on slightly squarer ones. Some of you might have a frozen shoulder, sports injury from rugby, repetitive strain injury, whatever it is, might mean you can't put your shoulder up, so you might need a different one. Some of you might struggle opening the caps and are finding you're using scissors or DIY pliers, or are you asking your next door neighbour to open them, but because they are shielding or COVID isolating, they're not there to open up these bottles, and then you might be going without doses, and you might need a rubber bottle opener. So there's all different ones depending on your needs, but your pharmacy team will be able to hopefully help you with which ones are more appropriate for yourselves. Next slide, please, Robin. So your pharmacy team, if you're finding putting drops difficult, and it doesn't matter if you've been using drops for years or years, and as Robin said in her opening introduction, she did say there's no such thing as a silly question, just the question that you haven't asked. So please ask your pharmacy team anything for advice on putting your drops in, because your pharmacy team really want to help you get the most out of these medicines. So you can also speak to Glaucoma UK. If you're a Moorfields patient, we've got a helpline, and there's the Moorfields website, and it really is okay to ask anything at all on using these drops, squeezing them, whatever it can be. please do feel free to ask at any time. Pharmacy is there to help you. Next slide, please, Robin. And something else your pharmacy team can help you with, thank you, is supporting you with the timings of drops. We spoke earlier that some drops work better at certain times of day, but ultimately we want to help you weave that into your lifestyle and also make sure these drops are suitable for your lifestyle. We all have a life, we need to go out and do our own things, but the burden sometimes of these drops can be quite challenging. So your pharmacy team really is there to help you work out the best time with what you're doing. And as Kathy said, building it into your routine. So just as Kathy said, maybe there's a television or radio show that you listen to every day. It could be the 10 o'clock news, for example. Putting in your drops there might just help you build it into your routine. You could be using them before you clean your teeth, after you shave, before you shower, after you shower. And as Kathy also said, keeping them by the bedside table. We've had patients who say, oh, I forget my drops because I fall asleep. Well, if you were to keep them in your bedside, maybe that would help because they don't want to go down to the kitchen, get cold and come back up. And so if it's not in the fridge, it could be easier. As long as it's safe for children, you haven't got the grandchildren, your own children, anybody's children running around, that could be a risk. Just where you store them might help. Making sure that what works for you is appropriate for you. It's your drops. What might be good for me might not be good for you. So it's all about speaking to somebody to give some ideas, but ultimately help you reach the best decision. As Kathy said as well, you might work shifts. So it's working out what we can do with that. And sometimes we have to change drops, and we would work that through with the prescriber. It's important that you leave a gap between your drops. And if there's lubricants, definitely I would use those after your glaucoma drops to make sure that the drops get absorbed before your next dose. Next slide, please. And your pharmacy team can also, with timings, they can do a dosing schedule sheet. We've got all sorts of ones we do with clock faces. We've got different ones with times of day. There's tick boxes, all sorts of things. Just they're all available, and it's about speaking to pharmacy to see what we can do to help you. Pharmacy can also help you with side effects. As we said in some of the earlier slides, we try to minimize those if we know you're allergic to anything. But as with all medicines, side effects can affect people in lots of different ways. With eye drops, commonly it would be slight blurring of vision or stinging after putting them in. Some patients, as Kathy also said, taste that bitter taste in the mouth if the drop has escaped through into the tear duct. And there's ways to prevent that from happening. Some drops might be quite specific to side effects and eye colours and eyelashes growing. Some people can get drowsiness and headaches, but it's not saying that you will, but you could. And just read the leaflet, refer to the leaflet and speak to your pharmacy team. And if you've got any concerns, particularly if you've read something on Google or heard something from a friend of a friend and you've decided not to use it, please do have that conversation with Glaucoma UK, your doctor, your nurse, your pharmacy team, and we can help support you with that, with the right information, help making you right the decision. If you're having any side effects, particularly if they're very severe, obviously call 111 and seek for advice and speak to your pharmacy team as well. Thank you, Robin. Next slide. And other ways your pharmacy team can help you. Anything about storage of medicines. Perhaps you're going on holiday, it's a fridge item, you're going on a trek to Africa, you've got no access to a fridge. Pharmacy can help work out a plan for that and help them work out a solution and organise for any prescription changes for that. Pharmacy can also help you with the burden of medicines costs. Some of you here might get qualified access to free medicines, but some of you in this audience might not. And it can be expensive for glaucoma medicines, but there are ways of doing prepayment cards over the course of so many months or a year, and you can have as many prescriptions as you can within that time for glaucoma meds and also for any other medicine. So pharmacy can help organise that. Pharmacy can also help you with automatic repeats, organising them with your GP, getting them to your chemist of choice over several months. They can also help with stockpiling. If you've got medicines that are just taking up room and you're not needing them, please let pharmacy know so you don't get those automatic repeats. Pharmacy can also help with any home delivery. Also, if you are isolating or you've got COVID, they can do drop-offs for you. So we said before, pharmacy can help with any timings and dosing schedules. They can also help with putting things in large font, language, different language. There might be opportunities for audio labelling, and if you've got vision impairment, pharmacy teams should be able to help with all of those things. And particularly with technique, if you're running out of your bottles too early in the month, your pharmacy should be able to help you with that, and please do ask them for some advice. And again, as Kathy said, if the bad taste is putting you off using the drops, your pharmacy team can help you. And Robin, if you could just click, please. The door is always open. The pharmacy team really wants you to get the best out of all of your medicines, not just for glaucoma drops, but everything as well. They might appear very busy, they might be very busy, the phone ringing and everything, but please do understand that pharmacy is always open to help you. They might not be able to help you for very long at that moment in time, but they'll be able to help you at some point. And please do remember that the door is always open. Next slide, please. Kathy, I think we're on to you now.
Kathy, you're muted.
You think I would have learnt by now to unmute, but I haven't. I'm so sorry, ladies and gentlemen. Okay, so we've got a few key things to remember as we come towards the end of this presentation. Glaucoma drops, you need to use them every day. You may not have been told that, you may have not been given that understanding, but it's really important to manage the pressure in your eye and to pick up your repeat prescriptions from your pharmacy. Don't run out. If you are running short, make sure you get your repeat prescriptions in. Storage, you will be given storage instructions. There are a couple of anomalies. That there is one that you have to keep it in the fridge until it's opened, and then once it's opened, you can keep it by the bedside and at room temperature for a month. It's always good when you do open your eye drop bottle just to put the date that you've opened it on the outside of the bottle, because they only last for 1 month. And we do get lots of patients that bring their eye drops in and they can't remember when they opened the eye drop. The reason it is an expiry date is due to bacterial levels and contamination, and just making sure that the medication is still working properly. So it's important to do that. Again, pharmacy's there to help. Leave a gap of between 5 minutes if you're using 2 different eye drops or 3 different eye drops. And again, speak to pharmacy. So next slide, please, Robin. Okay, so we've been talking to your pharmacy so much this afternoon, but we've only learned, myself and Sarah, through running the Know Your Drops campaign that we've done over the last few years. All of our knowledge has been learned from you, the patients. We welcome any feedback that you can give us, any questions that you'd like to ask us about your medications or how to use them, or any difficulties that you might be having that we can then raise to the manufacturers as well. And a good example of this is the Easy Squeeze drops that we've spoken to one of the manufacturers, and they have come up with a new aid to help with those particular drops. So we take your feedback back to the manufacturers, back to pharmacy. So please come back and share your experience. And just remember, we're never too busy to help. We're always there. So thank you very much. And we're opening the floor now, Robin, to any questions you might like to pass on to us.
Thank you very much, Kathy and Sarah. That was really, really informative. We've had absolutely loads of questions, so I'm going to rattle through as many as we can. And I'm conscious that we started a couple of minutes late. So let's get going. So the first question that's had a couple of likes on here says, bearing in mind that some drops may go into one system despite pressing with the finger, should you do your drops at different times from other medicines, e.g. blood pressure tablets?
That's a really good question. You're absolutely right. So a lot of people forget that eye drops can be systemic. They are localized into the eye. Sarah might might want to jump in here, but for me, it would be a case of like, stick to the times that your eye drops are, and also any systemic medications, stick to the timings you've been told with those. They don't tend to interact, but Sarah might want to jump in here.
Yeah, oh, I'm not sure where am I mute.
No, we can hear you.
So low from being absorbed in systemically, especially if you're doing the punctal occlusion. Not that I'm aware of, to use them at any different times of the day.
Great. We've had a couple of questions here about Ganfort. What's the best time to take Ganfort? I take Ganfort at night as per my prescription, but I've read that Ganfort's best taken in the morning. Any information on Ganfort?
So Ganfort is once a day, and it can be used either in the morning or the evening. The main thing I would say is try and stick to a time that suits you best. There is some evidence out there from different studies and looking at the time of day specifically as past, what is going to be the best one. And then some of that evidence does suggest that evening is more effective for the lowering of the pressure in the eye than rather than the morning. However, it's not necessary to be in the evening. So there might be marginally better outcomes for your pressure, but it's got to be balanced on, is that going to be an easy time for you to remember every day? Is that going to work with your lifestyle? Because you're also going to get benefit from using it in the morning. So either are fine, but there is some evidence to suggest that evening is better, but it could be used in the morning. It's not a right or wrong, and it could be better in the evening would be my synopsis.
I think also, Sarah, that's the problem with some of the combination eye drops. So the idea is to get away from using two different eye drops, but them being taken individually, that they would recommend that one or the other would be taken at individual times. So it is like with Ganfort in particular, it's one of those ones that whatever suits you best, really, because you're getting the two medications in one and you only have to take one eye drop. So
great. The next question is, despite pressing my eye corner, a fair amount of each drop seems to escape down my cheek, needing to be mopped up by a tissue. How concerned should I be by this?
So,
sorry, go Sarah.
You're not alone. I can guarantee it's not just you you've had this. But the key thing is to try and get that drop in the eye, because you're quite right from raising it. If it's running down the face, it's probably not helping your pressures as much as it would do if it was going in. So I would have a think about your technique, whether you're tilting your head back enough, or maybe you're not lowering your lower eyelid to create a pocket for that drop to go into. So if the drop really is going on your cheek, then I put another one in. But if that's also going to run down, really just think about how you're putting the drop in, because I would be concerned, because if it's going on your cheek and it's not going in your eye, that's not helping your pressures as much as it would be if it was going in your eye. And you're just going through all of this, getting your prescription, opening your bottle, setting aside a time and putting it in, but it's just running down. That's not helping your pressures, and that's not managing them. And maybe next time you go, you'll find your pressures aren't lowering just because your drop's not going in the eye. So I'd have a think about your technique and have a look at the videos and speak to the pharmacy team. Maybe someone can watch you. Sometimes it's just about moving your arm just a little bit, angling it just half an inch or not even that to one side, and then you'll get it in every time. But certainly if it's going in every time, running down your face, I'd be thinking, what can I do to improve that?
Great, thank you. We've got a question about brinzolamide. Started using it twice a day, feeling lightheaded, dizzy during the morning after using the drops, although it disappears early afternoon. Could this be due to drops?
Yeah, it very much could be. It's hard to know if that's the case straight after that you started using them. It could be. Yeah, what were the side effects? Sorry, did you read out? You said
lightheaded and dizzy.
Lightheaded and dizzy. It could be lightheaded. It's quite uncommon to get cardiac sort of symptoms, like but it could well be. You speak to the doctor about it. I haven't personally come across that one with brinzolamide.
I'd be looking into, are you using punctal occlusion? Are you doing that little to stop the eye drop going into the system as well? And it sometimes you do develop side effects when you first start using eye drops, but they continue until you get used to them. It's a bit like any systemic medication you may take. You get side effects when you start taking them, but as your body gets used to using them, those side effects do. But like Sarah said, definitely have that discussion with your clinician, because although people do think that eye drops aren't going to affect you internally, they can do, especially if you're particularly sensitive. So punctal occlusion, check with your clinician, and it may just be your body getting used to using them. So
I've just looked up the document that I have here, and it said that dizziness is quite uncommon with brinzolamide. But again, uncommon, how many is that? And somebody's got to have it, and it might just be unfortunate it's you. So see how it goes. If it's causing you a problem, if you're lightheaded and you're dizzy, that's a safety risk. Before anything could happen. So I think that's something to speak to the doctors about. They might monitor it, they might change it, they might see if there's anything else that's causing it. But if it's coinciding that you're getting these side effects and having this new drug in, and you're doing the punctal occlusion, as Kathy said, that maybe they need to look into it, because it could be a problem.
Great. My main problem is ensuring the bottle is in the middle of the eye. How does the risk technique help that?
Right. Yeah. So I'll just demonstrate again. So what you're doing is you're making a fist like this. I hope everyone can see this. And you're pulling down the lower lid and then looking up. So the wrist technique, it takes a little bit of practice, and it's how to position your actual eye drop to get it in the eye. Once you've got that position, you tend to get it in the eye every single time, because your hand's being steadied and you're looking up into the eye with that actual bottle. So if you are concerned at all, definitely ask someone to watch you when you're using that technique, because if you stand to the side of a patient that's using that technique, you can actually see where the bottle's being positioned. So maybe you can even use a friend or a relative or a partner just to watch you put that eye drop in, and they can sort of say, no, then you just move it a little. And like Sarah said, it might only be half a centimetre or a few millimetres, and that eye drop's going to go in. But using that wrist knuckle technique is steadying your hand and helping you put the eye drop in.
Great. We've had a question here that says, is Moorfields Direct Helpline open to non-Moorfields patients?
It's for Moorfields patients. We wouldn't be able to Moorfields, but the Glaucoma UK has a really great open house, if I'm not mistaken.
It absolutely does, yep. Any issues, if you're not a Moorfields patient, please do give our helpline a call. Beta blocker eye drops I take at night, although I've heard I shouldn't take beta blockers at night.
Is it Zalacom or something?
It is Zalacom, yeah.
You can use it once a day, as long as it's once a day. It doesn't really matter for something like Zalacom. Some people do take it at night, some people take it in the morning. I haven't come across a reason not to for the drops. It might be because that would be an oral beta blocker, people take them in the morning, but it's an eye drop, so it's not going to get absorbed in the same way. And as they get that body, they just want a day that works with your lifestyle.
Great. I'm just going to squeeze one last question in because I'm conscious of the time. I am really sorry we haven't managed to answer all of the questions that are on here today. You've had so many for us. Please do call our helpline if you need answers to questions that we haven't given. Somebody has put on here, I used to have lots of problems obtaining eye drops from the pharmacy, especially Simbrinza. Would there be any way of letting patients know about problems so that pharmacists are alerted in time to advise patients?
That's a really good question. We do tend to get alerted by the manufacturers if there is a manufacturing problem. And what we do tend to do at Moorfields, because we give out so many eye drops, we pass that information on to as many people as we possibly can. Sometimes that doesn't filter out to the local pharmacies, but if you are finding that any of your pharmacy is having a problem, ask them to go back to the manufacturer and find out what the problem is and what the lead time is. And you can always check with your clinician as well if you are having trouble getting the eye drops that you've been prescribed, and they may give you an alternative as well.
Yeah, and I would add to that there's a lot of cascades in the NHS with open communication of everything. So your local pharmacy will be part of a group, a wider group. Top of that will be another group, and if there's anything to do with the procurement of medicines, it gets through. So everybody is alerted to these things, and provisions will be made, and prescribers will also be in any of that. So if there's going to be shortages, we'll be made aware of that, and a plan B will be put into place. But if you're worried, as Kathy said, to speak to your pharmacy, speak to your doctor, because everyone is working to make sure that everybody in the whole country doesn't go without, and has a plan B, and particularly for these types of medicines, because they need to be used all the time with no gap. But certainly, if you're concerned at all, do speak to your local team.
That's great, thank you. Right, I'm just going to pop the second poll up. I will leave it open whilst I say goodbye to you all. Thank you so much to everybody for joining us, to Sarah and Kathy for such a wonderful talk this afternoon. We hope that you found it useful. On the screen here are the details for the helpline. If we haven't been able to answer your question today, our helpline team will be happy to help you. Please contact them with any other questions that you may have about glaucoma at all. Our next digital support group will be on the 22nd of February and is titled Everything You Ever Wanted to Know About Glaucoma. They've gone for a pretty ambitious title there. We do hope that you'll join us for that session. I do hope that you've enjoyed today. If you could continue those answers flooding in on the poll, that would be wonderful. They really, really help us to find out how these sessions have gone. At the end of this, there will also be a Survey Monkey that will come up on the screen. If you're able to give us any feedback on that as well, that would be absolutely wonderful. Thank you again to Sarah and to Kathy for your time today. And it's been lovely to speak to you all. I'm just going to give 2 more seconds and then I'm going to end this poll. Thank you ever so much. I hope you enjoy the rest of your day. Apologies for running over, and thank you for putting up with all of my slight technical issues today. Hope to see you soon. Take care. Bye-bye.